What is the history of Roman anesthesia? Have you ever wondered how ancient Romans managed pain during surgeries? The history of Roman anesthesia is quite fascinating and reveals much about their medical practices. In ancient Rome, anesthesia was quite basic compared to what we know today. Roman medicine was heavily influenced by Greek practices, and physicians adapted various natural substances to help manage pain during procedures. One of the primary techniques used by Roman doctors involved sedatives and analgesics derived from plants. A common method was to induce a state of catalepsy, which is a trance-like condition. This was achieved by combining sedatives with strong pain-relieving agents. This approach allowed surgeons to perform operations with less distress for the patient. The most frequently used analgesic was powdered opium, which comes from the poppy plant. Romans often mixed opium with wine to enhance its effects. Opium was highly valued for its strong pain-relieving properties, but it had to be imported from the East through trade routes like the Silk Road. Other substances used included mandrake, henbane, belladonna, and scopolamine, all known for their sedative effects. Roman surgeons primarily applied these techniques in battlefield medicine and routine surgical care. However, they did not have effective general anesthetics for deep surgeries as we understand them today. This limitation meant that many operations were restricted to superficial or less invasive procedures. For instance, cesarean sections were sometimes performed, but the survival of the mother was rare due to the lack of advanced anesthesia and surgical techniques. To maintain cleanliness, surgical tools were sterilized by boiling, and wounds were cleaned with acidic vinegar to prevent infection. While pain relief was important, the experience of surgery was still harsh. The use of sedatives and analgesics aimed to reduce suffering and help the surgeon, but full unconsciousness was not possible with the available substances. In summary, Roman anesthesia relied on sedation and analgesia using natural plant-based compounds like opium and mandrake. These methods represented the best pain management options of their time, but they were far from the depth and safety of modern anesthesia. Roman medical practices laid the groundwork for future developments in pain control and surgery.